Well, would you volunteer to be deliberately infected with coronavirus if it would speed up research into a vaccine? More than 30,000 people around the world said yes. As Raf Sanchez tells us, One Day Sooner campaign volunteers are deliberately allowing themselves to be infected with the virus to test how effective a vaccine is.
More than 30,000 people worldwide have agreed to what many would consider unthinkable: to be deliberately infected with coronavirus. Their aim is to help speed up research into a vaccine. 18-year-old Alistair from the UK is one of them.
I don't think that those risks and that worry is something that is going to stop me, because I know what I'm doing, I know why I'm doing it.
More than 160 COVID vaccines are in development, but only a handful are in phase 3, ready for large-scale testing. Russia this week approved a vaccine, but without going through phase 3 tests standard in the West. Scientists usually only know if a vaccine works by waiting for volunteers to catch the virus naturally. That can take months, even years. But there's another, more controversial path: human challenge trials, where scientists infect volunteers with the virus on purpose. Results can be faster, but the stakes are high. None of the research labs racing for a COVID vaccine have started human challenge trials yet. But scientists here at Oxford, who have one of the most advanced programs in the world, say such trials could play a crucial role in speeding up the process.
Desperate times may lead us to think about cutting corners, but there are reasons that human challenge trials have been set up in the way that under normal circumstances they're carried out, which means we have to have either a rescue therapy or it's known to be a self-limiting illness or disease.
Volunteers like Alistair are part of the One Day Sooner campaign. Backed by Nobel laureates and world-leading scientists, their message is clear. If a vaccine can be found even one day sooner, it would save thousands of lives. Scientists are divided over how to trial a coronavirus vaccine. But one thing is not in question: this pandemic only ends when they succeed.
Well, there's a new drug on the president's radar in the fight against coronavirus. MyPillow creator Mike Lindell claims President Trump is, quote, enthusiastic over the unproven coronavirus therapeutic Oledron. It's an extract from a highly toxic plant. Lindell says he and President Trump talked about it in a meeting last month. The president told reporters today he has heard of the drug, but wouldn't say if he endorses it. The FDA has authorized the emergency use of the coronavirus test that uses saliva. The Yale School of Public Health developed the test, which does not use chemical reagents used in nasal swab tests. The test, called Saliva Direct, is already being used on NBA players and staff. Researchers plan to make the protocol available to other labs around the U.S. and expect the charge to be about $10 per sample. Yale has said the test's accuracy is similar to the nasal swab test, though that hasn't been peer reviewed.